So first I invite Dr. Shruthi to present association of Loxl1 gene and serum folate levels in pseudoexfoliation syndrome and pseudoexfoliation glaucoma in South Indian population.
I'll start, sir.
Yes.
Hello everyone, this is Dr. Shruthi from Chennai, and my presentation is on association of Loxl1 gene and serum folate levels in PXFS and PXFG in South Indian population. So genetic predisposition, particularly mutations in Loxl1 gene, is strongly associated with PXF and PXFG. So these mutations have reduced enzymatic activity, which impair the elastogenesis and promote the accumulation of PXF material. Folic acid is associated with homocysteine metabolism, oxidative stress and vascular dysregulation, which contributes to the PXF pathogenesis. So the objective of this study is to determine the genotypic frequencies and association of single nucleotide polymorphisms of the Loxl1 gene, namely the AIOS2025 and AIOS3825942 with XFS and XFG in South Indians, and also to determine the concentration of serum folic acid levels in XFS and XFG, and to analyze the association between the Loxl1 gene and serum folic acid in patients with XFS and XFG in South Indians. So it was a prospective interventional case control study which had a sample size of 30 with XFS, 10 with XFG and 40 age-matched controls. And patients with any ocular morbidity or taking any vitamin supplements and folic acid were excluded. The chromosomal DNA was segregated from the blood samples, and serum folic acid estimation was done using the immunoassay. And statistical analysis was entered in 26.0 software. So this is the demographics, where you can divide the groups either into 2 or 3. When dividing the groups into 2, you had the study group which comprised of the XFS and XFG patients, and the control group which had only the age-matched controls. And this can also be further categorized into 2 subtypes, the XFS separately and the XFG and the control group. So this slide, it depicts the association between the 2 groups and genotypes of the SNP RS10486661, which showed that the genotype TT was significantly more and the TG was less in the study group when compared to the controls, and GG had no significant differences. While comparing the association between the 2 groups and genotypes of the SNP RS3825942, there was no significant difference in the association. And on association between the 3 groups and genotypes of SNP RS10486661, we found that the TG genotype was more in the XFS than compared to the controls, and GG was significantly less in XFS and XFG. While comparing the median values of serum folic acid with XFS, we found that they were higher in the control group. So this implied serum folic acid levels were associated with XFS, and this can be useful in screening and monitoring the exfoliation syndrome. While comparing the median values of serum folic acid of the 2 groups with genotypes of both SNP, it revealed that only the RS3825942 single nucleotide polymorphism had a significant association with serum folic acid levels in the study group. While comparing the median values of serum folic acid levels between the genotypes of the Loxl1 in the SNP of 3825942, we found that the TT and the TG genotype had significant differences between the median values of serum folic acid amongst the study group. So which implied the low levels of serum folic acid had a presence of heterozygous genotype, which is TG, and higher levels of serum folic acid had the TT genotype amongst the study group. So thus, to infer, we found that the serum folic acid levels were significantly less in the XFS and XFG patients, and the Loxl1 RS3825942, the TG genotype, had a lesser value of serum folic acid levels than that of the TT genotype. And similarly, the lower serum folic acid levels in the population with the XFS indicates a higher chance of presence of Loxl1 RS3825942, the TG genotype. On discussion, the meta-analysis of published studies in multiple populations implicated the RS3825942 as a main disease-associated SNP and XFG. However, in this study, we found that the homozygous dominant genotype of the RS10486661 and the genotype of the RS3825942 had a positive association in the XFS and XFG patients. The greater deficiency was observed in the South Indian cohort, which can be due to the regional dietary habits low in folate-rich foods. So thus, studies with larger sample size across diverse populations and considering all the confounding risk factors to be considered to draw safe conclusions in the future. So to conclude, this is the first study to find an association between the Loxl1 gene mutation, single nucleotide polymorphism and serum folic acid levels in Indian population. So on future directions, we have to consider the genetic screening, nutritional interventions, integrating both the profiles and examining the combined impact of genetic and nutritional factors on disease progression and provide insights into therapeutic strategies.